The reality is, for the political debate in many, many countries now, COVID is in the rearview mirror. I mean, it isn't, but believe me, most the people sitting in Downing Street at the moment are not talking about COVID. And at the G7 and the G20, I think you won't get the focus you need unless it's clear two things. One, that there is an ongoing challenge and opportunity. And I think that is not just about COVID. It's about the fact that we are going to have a whole slew of new vaccines, injectables, that are going to deal with some of the worst diseases in the world, that give us the opportunity to make big changes in the health of the world. And if you want the politicians to focus, they need to think, look, this is coming down the track soon, because if you tell them about a future pandemic, they'll kind of go, yeah, no, maybe someone else's problem. But you tell them, actually, in the next few years, you're going to have the opportunity to make a big difference to the healthcare of your population. That will focus them. I think there's a huge impetus now for a national digital infrastructure. Digitization in healthcare is, I think, one of the great game changers. You know, we should be helping countries to develop a national digital infrastructure, which they will need with these new vaccines. I think there's sort of unforgivable politics and forgivable politics. The unforgivable politics is turning a public health issue into a political issue. I mean, I remember at the beginning of the onset of COVID, people saying, well, what do you think of the politics of COVID? How serious is this disease? And I was like, well, you asked me about the politics of the disease. I mean, it's a disease. I don't know. You go and ask someone who knows. So what's unforgivable is turning things like whether you wear a face mask or not into a political issue. That is unforgivable and stupid. Right. This issue to do with the technology and the digital infrastructure, I just want to emphasize how important I think that is. Because in the end, you need the data. You need to know who's been vaccinated and who hasn't been. Some of the vaccines that will come on down the line will be multiple, there'll be multiple shots. So you've got to have, for reasons to do with the healthcare more generally, but certainly for a pandemic or for vaccines, you've got to have a proper digital infrastructure, and many countries don't have that. In fact, most countries don't have that. So again, you've got to say, okay, who are the people that can make this happen? How do you get the right partnerships in place? So my view is, this is what I'm arguing with that should happen in the G20 particularly, I think, which is, I mean, G7 is an important forum, but the G20 is the broader forum, is you've got to work out what is it that you want to achieve in order to make sure that any future pandemic is properly handled, and what are the partnerships that you're going to create in order to ensure that the answers you get are the right answers. And then you're going to have the mechanisms of implementation. And those mechanisms will be partly through the formal institutions that you have, like the WTO, but they'll also be through organizations like yours, which I think, you know, have many advantages because they don't get landed with the same bureaucracy and, frankly, small p politics around them. So I think, you know, that's what we need to do. But if you want the politicians to focus on a plan, I promise you, it's got to be because they think in the next few years, not in the broad future, it's going to matter to them to have that plan.